Hi, my name is Alexis Kelly. I'm a nursing student here at FSCJ, and I'm going to be demonstrating IV med administration through a piggyback. I would first check my doctor's orders against the MAR and make sure they're correct. The doctor has ordered Rocephin. Rocephin is going to bind to the bacterial cell wall and cause cell death, and it's used to treat many different types of infections. The safe dose is 2 grams every 12 hours, and that's the dose we will be given today. I need to know the side effects of my med, the contraindications, adverse reactions, as well as nursing interventions. And before I give this med, I do need to know the patient's allergies as well as their lab values to make sure this med is okay to give. At this point, I can go ahead and draw up my med. I'm going to perform hand hygiene. I'm going to look at my bottle, make sure it says Rocephin, and look at the expiration date, and it is still good. I can draw up a ml of air in my syringe, inject the ml into the bottle, and draw out my 1 ml of medication. I'm going to recap my needle, and I can go ahead, get my mini bag, and inject the medication into the mini bag. I'm going to first grab an alcohol prep, swab the tube of the mini bag, and inject my medication. Take the syringe out, and I'm going to throw away my syringe into the sharps. I'm going to mix the bag, and I will label the bag with the drug, the amount, the dose, the route, the infusion time, the date, and my initials. I can go ahead and spike my bag using my secondary tubing. I'm going to prime the drip chamber, unclamp my tubing and prime the tubing, make sure all the air is out. Right, once I've done that, I'm going to label my tubing with my initials as well as the date and time. At this point, I can take all of my materials as well as the doctor's orders into the patient's room. I would knock on the door, introduce myself, identify the patient using 2 forms, their name and their birth date, and check it against their armband, as well as have them repeat it back to me. I am going to perform hand hygiene and put on my gloves. I'm going to explain the procedure to the patient, let them know that they are getting Rocephin through an IV for their infection. I'm going to tell them about their lab values, any kind of signs of an allergic reaction or adverse reaction. I'm going to palpate the IV site and look at it, make sure it doesn't have any phlebitis or infiltration. And it doesn't, so it's good. At this point, I can go ahead and put my piggyback onto the IV pole. I'm going to lower my primary. I'm going to use my alcohol prep, and I'm going to clean the port of the primary as well as the port of the piggyback. And I can then connect the 2 once they're clean. I'm going to clamp my primary and unclamp my piggyback. I'm going to establish the flow rate, which I prior calculated to be 17 drops per minute. I'm going to use my watch. Okay. Once I've done that, I'm going to make sure it's unclamped fully. Clamp the primary. I'm going to let the medication run at this point. I'm going to let the patient know to let me know of any signs of infection, allergy. I'll come back into the room over the course of the medication administration and check on the IV site for phlebitis or infiltration or an allergic reaction. I would obviously take off my gloves and perform hand hygiene. Once the medication administration is over, I can come back into the room, perform hand hygiene again, and put on clean gloves. I'm going to check the IV site for phlebitis or infiltration. I'm going to clamp off the piggyback 2, unclamp my primary, and reestablish the drops per minute. And I would watch my watch for that as well. You can go ahead and unclamp the piggyback. and I would need to get a new alligator clamp for the next med administration. I'm going to check the site one more time for infiltration of phlebitis and allergic reaction, ask the patient how it went for them. I would then take off my gloves, hand hygiene. I would document the time, the drug, the dose, the route, the condition of the IV site, and the intake and output as well. And then I would be done. Thank you.